Hello, wise Madine, watching from Malawi. I'm sorry the life is starting late today. I had a lot on my decks I had to clear. So I'm just coming to see if there is one or two questions for me to take tonight. How are you doing, wise Madine? Trust you're doing great. It's a beautiful evening. I had a very busy day today with kids and everything, so it was quite stressful for me today. Doing good, thanks. Thanks for joining our live. So today, I don't think we're going to have any specific topic. Today is just going to be, if you have any question, drop on the comment section and we'll try as much as possible to provide useful answers for you. So that's what I'm going to be doing today. David Kafupi, how are you doing today? I'm doing great. How are you doing? How are you doing, David? Trust you are doing great. David said he's fine. If you're coming across to this, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I am currently practicing in the UK as a registered adult nurse. But I work in a theater as a recovery and anesthetic practitioner. So what we do on this channel is everything health. We give you useful advice in regards to your health, in regards to sex and reproductive health. Those questions that you are shy to ask your doctor, this is an opportunity for you to talk about it. Those questions that your doctors might not have the opportunity to talk about, this is an opportunity for you to talk about it on our YouTube channel. So if you're coming across this channel for the first time, all you have to do is to subscribe to the YouTube channel and also turn on that notification bell so you don't miss out whenever we come live. And if this is your first time, please subscribe, turn on the notification button, and don't forget to double tap the screen just to like the video. Don't forget to tap the screen just to like the video. So Wise Madin said, you said that granules help for sperm, but what kind of nuts between fresh one or frying ones? Generally, I said nuts, but the best nuts when it comes to sperm is actually the ones that are rich in omega-3, folate acid, and antioxidants, including zinc. So nuts like walnuts, almond nuts, and hazelnuts. It doesn't really matter if they are fried or boiled. They are nuts, all right? They could be roasted, but as far they are not, they are actually generally, they are good generally for your sperm. Hello, Lambe. How are you doing? Trust you're doing great. You're welcome. So nuts are generally good for when it comes to sperm. Nuts are good for sperm because they have this zinc in it, some contains omega-3, which are very necessary for your sperm health. So as far they are nuts, it doesn't really matter how you prepared it. It could be fried, it could be roasted, it could be boiled. They are nuts. They are generally healthy for you. All right. So all you have to do if you're just coming across this channel for the first time, double tap the screen to like the video. Don't forget to subscribe and don't forget to also share the live video. If you are watching us, just say hello in the comment section and also say hi in the comment section. Let me know you're watching. Let me know you are hearing our voices. And if there's anything you would like us to discuss tonight, kindly drop on the comment section. For tonight, I had a busy schedule today, so I was unable to prepare a particular topic for tonight's live section. So that was why I decided to come and take any questions, take as much questions as I'm able to take today, because I did not have the time to actually prepare a particular topic for today's night. But a particular video is supposed to drop by 12 p.m. today. Let me check. 12 a.m. tonight. I think the video was supposed to be talking about testicular pain, testicle pain. For those that have experienced testicle pain, but that particular video is supposed to be dropping 12 a.m. or I think 12 a.m. If it's not dropping 12 a.m., it's going to be dropping at maybe sometime tomorrow. Today, from tomorrow, just expect the video. If it did not drop 12 a.m., it's going to be like 8 p.m. or 10 p.m. the video is going to be dropping. So if you have any question, all you have to do is to drop it in the comment section, and I will be willing and ready to take the question. So that is why I am here today. Like I earlier said, if you have any question, drop in the comment sections in regards to your health. Those questions you are scared about to ask your doctor, this is an opportunity for you to ask Nurse Mercy. And those questions that your doctors might not have the whole time to explain for you, this is an opportunity for you to ask Nurse Mercy. Hello, Maureen Chuzi. How are you doing? Trust you are doing great. Hello, Gideon. Good evening, Gideon. How are you doing? It's nice having you all in my life tonight. If you have any question, drop on the comment section. That is why I am here tonight. Like I earlier said, I don't really have any topic planned out for tonight. So the topic is going to be determined by what you drop on the comment sections. It's going to be determined by your questions, and it's going to be determined by what you want me to talk about. Gideon said, I'm good. Please answer my question. Gideon, your question is not in the comment section. If you know you typed the question, sometimes when some questions go against YouTube policy, YouTube might not allow the questions to appear. So all you just have to do is to do 1 or 2 modifications on the questions for them to appear. So if you know you've typed the question, I would advise you type it again and do 1 or 2 modifications on the questions so that I'm able to get it. But now I am not seeing any question from Gideon at the moment. I am not seeing any questions from Gideon at the moment. If you are joining, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but currently practicing in the UK as a registered adult nurse. So please, let's just keep the questions coming. Lambibe say, please, apart from eating on time, how else can peptic ulcer be managed? First of all, if the doctors have diagnosed that you have peptic ulcer, at the very beginning, they might give you some antibiotics because the cause of peptic ulcer is actually a bacteria known as Helicobacter pylori. So they might give you some antibiotics to help with the bacteria, such as azithromycin and clarithromycin. They might also give you some painkillers to help with the pain. But outside that, what I generally advise for those that have ulcer is actually lifestyle. Outside the drugs that you are taking, your lifestyle goes a long way to help when it comes to ulcer management. The first thing is to avoid smoking if you are smoking. The next thing is to avoid alcohol if you are taking alcohol. The other thing is to avoid caffeine if you are always taking caffeinated drinks, coffee, tea, like any drink that have caffeine in them. They might stimulate that ulcer. So it's advisable for you to stay away from that. Avoid spicy and acidic food. You should avoid spicy and acidic food because spicy and acidic food are likely going to trigger the symptoms of ulcer. So if you have ulcer, instead of you to be eating in larger quantity, it's better for you to be eating little quantity at a time. If you have ulcer, it is better for you to be taking little quantity at a time. If you are supposed to eat 3 times a day, if possible, take that means 6 times. Take it little by little. That's for your breakfast. If you can split your breakfast into 2, make it like take half of your breakfast now, then take the remaining 1 later. That's going to go a long way. Instead of eating it voluminously, like you finished 1 hefty food at a time. Eating your food little by little is going to go a long way to help with ulcer management. Then if you are always stressed out, try as much as possible to reduce anything that's going to stress you out, because stress can aggravate ulcer. So these are the key points you need to take note of when managing ulcer. And also, in addition to what I just said, when it comes to ulcer, when it comes to ulcer, it does not have cure. There's no cure for ulcer, but rather it can be managed. There is no cure for ulcer, but it can be managed. So if you notice that there is a particular food that you eat, whenever you eat this particular food, you start having this ulcer pain, stay away from those food as soon as possible. If you notice that whenever you take that particular food, it aggravates that particular ulcer, it's advisable for you to stay away from that ulcer. And if you are someone that usually take all these energy drinks, like what's this popular energy drink? I can't remember. But if you take any energy drinks, I would advise you to stay away from those energy drink because they are likely going to aggravate the symptoms of ulcer over time. Eating healthy veggies are very, very important. It's going to go a long way to also help when it comes to ulcer. That question was asked by Lemby60. Lemby60, I believe your question has been answered. So Gideon said, what makes manhood to shrink? One of the things that makes a manhood to shrink is age. With age, your manhood tends to go down over time. Yes. As you age, it's no longer going to be like the size or the shape you have when you were at your early stage of life. It's going to change over time. So age is one of the leading cause of shrinkage in your penis. As you old, it's going to go down. So what I would advise you, if you really want to continue enjoying your sexual life, even if it's not going to be 100% like when you were in your 20s or when you are in your early 30s, it is advisable for you to start taking some fruits, some veggies. Like I said in my previous video, having smoothies instead of those caffeinated drink, instead of those alcohol, having smoothies is going to go a long way to help with your manhood, like you called it in the question. Having smoothies is going to go a long way to help with your manhood. Stay away from alcohol. Most people feel that when they take alcohol, it's going to help them perform well. But let me shock you. There's something called whiskey dick. And when whiskey dick happens, it's as a result of alcohol. When you take alcohol and whiskey dick affects you, it simply means that your dick is not going to be able to function like it would normally. I don't know if I'm making sense. So having a healthy lifestyle goes a long way to help. Just put it at the back of your mind that with age, the manhood tends to shrink. I don't know if I've been able to answer your question, Gideon. Diamond Weight Loss says, you going to the gym in the morning. Personally, I don't go to the gym in the morning. I try to stay healthy, so I do running in the house. I do some running in the house for at least 30 minutes. Then I also do some exercise for my tummy, like because I gave birth, so I don't really want my tummy to be bigger than it used to be. So I try to do some exercise in regards to tummy to help flatten it out. So that's what I normally do in the morning before my kids actually wake up. So that's what Diamond Weight Loss. I believe that answers your question. So Diamond Weight Loss said hi. Hello, Diamond Weight Loss. Isa Zachary said, hello, Nurse Messi. Good evening. Good evening, Zachary. It's nice having you on our live today. Gideon said, what causes penis shrinkage and what medications to take to enlarge it? I keep saying it on my YouTube channel is that most of us feel medications and tablets are going to help with penile enlargement. The fact is, most of these medications don't work. And most men out there that buy this medication are unable to come out. They are unable to cry out that these medications are not working because they don't want people to know what they are passing through. So having a healthy lifestyle is what is going to help you with your penile health. Having a healthy lifestyle is what is going to help you with your penile health. If you continue with all these medications they say, all in the name of penile enlargement, it's not going to work. Most of them don't work. You get. So I think that answers your question, Gideon. So we have Azania Meat Association. Azania, are you having meats for us? I like meat a lot. I like the beef. I like pork. I like turkey. It's nice having you on our live, Azania. So we have Hope One May says, good evening, nurse. How can heart palpitations be managed on an 83-year-old woman? Heart palpitations be managed on an 83-year-old woman. First of all, what I would advise you to do for that 83-year-old woman is to check her diet. what is she taking at that particular age? What food choices? What food choices is she having at that particular age? As little as the food choices can go a long way to affect their overall health. And you know, at that particular age, they are prone to a lot of diseases, illnesses, and infections. Like they are prone to go down because their immune system is no longer as strong as it used to be. While checking their diet, I would also advise you put her on monitoring in the sense that she has a doctor or a nurse coming to check her, and if there is anything, they're able to give proper medications. So that's what I advise for old people. When you are getting old, it's very important if you can get a personal nurse or a personal doctor that goes to the house, check them, do an overall check on them regularly just to make sure they are okay. That is going to go a long way to help. But make sure you check what they are eating at that particular age. That's what I will advise Hope, and I hope that helps. So we have Talabi. Spade said hi. Lambi said, thanks for the answer. Lambi, I'm glad your question has been answered. We have Sawyers Narayanan. Narayanan, hi. How are you doing, Soras? Trust you're doing great. Damod Westlaw said, are you going to do a dart stream? What's a dart stream? I don't know what a dart stream is. So my wife saw her period. Okay, Zachary, you said my wife saw her period yesterday. So how do I go about it? I wish I have a calculator with me. My body is far away from me. Zachary, can we do this calculation tomorrow? So tomorrow I'm going to bring my board closer. You're going to tell me her period, the start date for her period in June, and you're going to tell me the start date for her period today. So I can tell you, we can try see if we can predict her ovulation with that. Okay, Zachary, because my board is not with me on this live, and bringing it now is going to be something else. So what I would advise you to do is to actually wait like till tomorrow's live, then I'll see if I can help you calculate it. All right, is that okay, Zachary? Because I don't have a calendar with me. So Zachary, I guess that's okay if that's fine. So we have a question from Hope Wanem. Hope Wanem said, Hope Wanem said, what is the cause of hotness under the feet? Cause of hotness under the feet can be as a result of different reasons. Yes, it can be as a result of some peripheral nerve damage, peripheral neuropathy. I don't know how to break this down for you, but I don't know how to break this peripheral neuropathy down for you. It's like a nerve damage, especially in the feet and legs. And this is usually common in conditions, they are usually common with people that have diabetes mellitus that abuse alcohol. They are common in, that's my phone. They are common with vitamin B12 deficiency, kidney disease, hypothyroidism, HIV, infection, chemotherapy. But people with diabetes mellitus, at least alcohol abuse, all those people are likely going to have this peripheral neuropathy, which causes that hotness in their feet. I don't know if that makes sense. Matthew said, does birth control really work? Yes, I would say birth control work, but it is not 100% effective. Birth control work, but it is not 100% effective. Matthew, Sami, I believe your question has been answered. Birth control work, they work, but it is nothing is 100% effective for you to say, when you take this, it's going to prevent it totally. It works for a lot of people. Most of them are 90% plus effective, but it is not 100% effective. So Suranaya said, knee joint pain, any external application? I think your question is not clear, Sawyers. Yes, your question is not clear. doesn't mean you are having a knee joint pain. If you're having a knee pain, there could be different reasons for that pain. And one of the reasons most people experience pain is actually old age. As one age, a lot of things just go wrong with the body. So Zachary said, okay, may Almighty God make us to see tomorrow, but what time are we meeting? I keep saying 9 o'clock, but it's not, most times it's not doable by 9, but between 9 and 10, I'll be able to come online. Between 9 and 10, I will be able to come online. So that's what I can say. Between 9 and 10-ish, I should be online, depending on where my son sleeps. At least I am very, very sure that most times before 10, he sleeps. Just that when he sleeps by 10, I need to just get myself ready and get my lightning up. So between 9 and 10, I should be up. I should be live tomorrow, hopefully. So we got a Matty Somi said, what is the best way to prevent getting pregnant? One of the best ways to prevent getting pregnant is abstinence. Yeah. One of the best way to prevent getting pregnant is abstinence. I'm going to be telling you the other ways. But the number one ways to prevent getting pregnant is actually abstaining from sex. When you abstain, there's no need for you to be scared of anything again because you know you're not going to get pregnant. Then the second way that I advise, which is natural, it doesn't allow you, is that it doesn't permit you to take any tablets. You don't need to take any tablets. You don't need to take any medications. You don't need to take implants and all that. Is the natural method of family planning. As a lady, knowing your cycle, your fertile days and your infertile days, the day you are ovulating. So this particular method is more easier for someone that knows their cycle. It's more easier for someone that have regular cycle, not irregular cycle. You get, when you have a regular cycle, it's much easier for you to predict your fertile window and your windows that are not fertile. It's more easier for you to know your safe period and your unsafe period. So having that natural way is also one of the ways to prevent pregnancy. Withdrawal method is another way to prevent pregnancy. The use of condoms is another way to prevent pregnancies. But all these methods, like I earlier said, none is 100% effective. But at least these are methods without drugs, without implants, without anything going into your body. These are ways you can try to prevent pregnancy. The use of condoms, the use of condoms, the use of withdrawal method, the use of a lady knowing her cycle, that is also going to help. And if as a lady you are not on family planning, you have sex and you don't want to get pregnant, the next thing to do is to try the emergency contraceptive, which is the post-P, which is usually taken within 72 hours after unprotected sex. So in terms of post-P, you have to take it as soon as possible. The earlier you take it after unprotected sex, the better for you. So the more you delay, the more you are increasing your chances of getting pregnant. So if some people, they know they are going to have sex, the best thing they do is that they take the post-P before they have sex. They already know they are going to have sex, so they take it like before they have sex. But generally, like the name implies, emergency contraceptive, it should be taken when there's an emergency. You had it, you're not supposed to have the sex, and you have to just do away with it. So that's that. So Matthew Somi, I hope your question has been answered. Matthew Somi, hope your question has been answered. Then Diamond Weight Loss said, do you recommend abstinence? Yes, I recommend abstinence if you can. Yeah, I recommend it because with abstinence, you are not scared of having an infection. With abstinence, you're not scared of getting pregnant. With abstinence, you don't need to start putting any family planning on your body. So if it's something that's doable for couples, if not for couples, if you're married, no, I don't advise that because I feel sex goes a long way to build bond between couples. So I don't advise abstinence for couples. I don't advise abstinence for married people. I don't advise abstinence for people that are staying together. No, I don't advise it. So, but if you're single and the best thing I would advise is actually abstinence. So Hope One has said, thank you so much. You're welcome, Hope. Matthew said, not right, not trying to be weird, just need answers. Okay, Matthew, I think I've answered your question. Did you get the answers to your question? You are not weird. Like I earlier said, this is a safe space. Right? This is a safe space. Nobody's judging. Nobody's pointing accusing fingers. We are here to take your questions and we are here to give you the best possible answers. But for personalized healthcare, I would advise you usually contact your doctors. But this is just me explaining. It's a safe space. Feel free to express yourself in the comment section. It's not like Facebook. That's one thing I like about YouTube. I feel YouTube is more confidential. YouTube, your secrets are more safe compared to Facebook, where you have your family, people, everybody knowing your name. So I feel YouTube is more confidential. So that's why most times, that's why generally I feel safe. Like I feel safe doing this on YouTube because I know people are not easily exposed to criticism on YouTube compared to other social media where you can easily track someone and say, oh, this is my friend, this is my brother, this is my sister, or something like that. So that's one thing I like about YouTube. So like earlier said, this is a free space. Feel free to ask your questions in the comment section. Feel free to express how you feel. Then we'll try as much as possible to see how I can help you out. All right. We are here to learn from each other. I am learning from your questions and you are also learning from the answers I'm giving you. Okay. If this is your first time of coming across this space, my name is Mercy Mary. I am a registered nurse midwife, but I'm currently practicing in the UK as a registered adult nurse. I am a member of the UK YouTube Health. You can say it's the UK YouTube Health Nurse Mercy Mary. So, if you've not subscribed to our YouTube channel, all you just have to do is to click on the subscribe button and turn on the notification button. We promise to always drop interesting content soon. Though for the now, we are doing more of live, but we promise to drop interesting content soon. Then also subscribe to our YouTube channel. If you are watching this live right now and you've not double tapped the screen to like the video, I would advise you double tap the screen to like the video. Thank you very much. Okay, someone is asking, okay, Matthew, I don't know if you get answers to your question. So we have a question from Zachary. Zachary is saying, is Postinor 2 have any side effects? Generally, there's no drugs that don't have any side effects. Even as low as paracetamol you take for painkillers. Even as low as paracetamol you take for painkillers, it has side effects. So I'm going to be discussing some of the side effects associated with Postinor 2. And one of the side effects is that Postinor 2 can delay your menses or it can make it come on time. Everybody's body system is different. So when you take Postinor 2, you notice that, oh, you're supposed to see your menses on a particular day, but you are not seeing it. Is it that it's coming too early or it's coming too late? All right. And also to some people, Postinor 2 can make their next period either heavier or lighter. For example, you were using 4 pads before, but because you used Postinor 2, you might use an extra 1 pad, or you might use lesser. Maybe you can use 2 pad. So if you take Postinor 2 and you notice a difference in your menstrual flow, then Postinor 2 should be held responsible. All right. And with Postinor 2, you can have irregular spotting. There could be irregular spotting. If you take Postinor 2 and you're experiencing those little spotting just coming, then Postinor 2 might be the reason for it. Postinor 2 might be blamed for it. And one thing I don't like about Postinor 2, please don't leave as I say this thing. One thing you should know that I don't like about Postinor 2 is that it can alter your menstrual cycle. Yes, Postinor 2 can alter your menstrual cycle. And you know, when your menstrual cycle is altered, you are unable to track your ovulation. And you're able to track your filter and your safe and your unsafe period. So Postinor 2 can alter your menstrual cycle. If you're supposed to have 28-day cycle, if you take Postinor 2, it can alter it and give you a 33-day cycle. It can alter it and even give you 26-day cycle. So Postinor 2 can alter your menstrual cycle. That's one of the things I don't like about Postinor 2. So you know. And there are also some other side effects when it comes to gastrointestinal side effects, such as nausea. Some people take Postinor 2 and they are nauseating. Some people take Postinor 2 and they are vomiting with it. Why others take it and nothing happens? Some people take Postinor 2 and they have diarrhea. Some people take Postinor 2 and they have abdominal pain and cramps. But for some, they don't have anything. They don't even show any signs that they've taken Postinor 2. And also, there are some. Why am I using and also? Is my English language finished? Some people experience breast tenderness, mood changes with Postinor 2. Yes, they notice that when they take Postinor 2, there's breast tenderness, there's mood changes, there's fatigue, they're more tired, they're having headache. All these are just common side effects of postnatal. And less common, some people will tell you that they notice a change in their sex drive. Some people will tell you there's an increased vaginal discharge. Some people will tell you there's skin rash. So generally, people react differently. But the ones I listed that I said I don't like, one thing I don't like about postnatal is the fact that it changes your menstrual cycle. It is very common. It changes your menstrual cycle. So Zachary, I hope your question has been answered, Zachary. Because said is postnatal have any side effects. So I've given you the different side effects that come with postnatal. But the one I don't like is that it affects your menstrual cycle. So Somi said, can you answer my last two questions? Somi, your question has been answered. So I don't think there's any question that we've not answered. Except your question is going against duty policy and it's not popping up. The question that you dropped about best way to prevent getting pregnant, I've answered it. I don't know if you got it, if you were online while I answered it. Are you getting that? Matthew, do you understand what I said? If you know that you were there when I answered your question, can you drop in the comment section? Because I don't know which question you are actually talking about. I'm waiting for Somi because she keeps saying that I didn't answer. So James said, sorry, let me read. James, please, if someone have infection and go for HSG, will everything be fine? There's a possibility that everything will be fine. But generally, I will advise you treat that infection first before going to HSG. Because when you go for HSG with infection, it can actually push that bacteria upwards. It can actually push the whole infection, depending on the type of infection, it might push it upwards, causing more serious problem. So what I advise is that before you go for HSG, treat those infections first. So that, because the HSG, they are taking something inside, is going up. So to avoid that movement of the infection that was down before to circulate around, I would advise you get that infection treated first before going for HSG. So, James, is your question answered now? In seats, James, is your question answered? So, Matthew Sam said, what is the easiest position to make a girl squirt and how to use a vibrator? Okay, I don't know about vibrator. What I have to say about making a lady squirt, if you want to know, I think that depends on the woman. Every woman has their own how will I put it now? Every woman or every girl has their how will I put it, what they call it now, their G spot. So it's just for you to know your partner's G spot and what works for her. So know what works for your spouse, and that's it. That is why when it comes to sex, communication is very important between both parties, between the husband and the wife, between the partners involved. So for you to make them enjoy the sex, for you to make them squirt, like you said, it's very, very important for you to ask your partner what actually turns you on, what makes you want more, like what is your G spot. This is a question between you and your partner. All right, so that's not what I can give explanation for. So easiest position to make girls like a fountain in the bedroom and how to use it. I've answered that question, Matthew. I think I've answered that question, Matthew. That depends on you and your partner. So that depends on her, because every woman has what they like. What a particular woman likes is different from what another woman likes. So you have to communicate about sex. I think that's very important. We communicate as partners. I think most partners, they communicate about everything. They communicate about finance, they communicate about kids, they communicate about career, but they fail to communicate about intimacy. They fail to communicate about sex. So I think it's very important as partners, as couples, communicating about preferences, communicating about what you like and what you don't like is going to go a long way to improve and enhance sexual life. So if you've not been doing that with your spouse, if you've not been doing that with your partner, I would advise you to ask them what's best work for them. So that's what I have to say, Matthew, and I hope that helps. So James said, yes, ma, thank you so much. Thank you, James. I'm glad I have been able to answer your question. So let's keep the question coming. I am ready and available to answer them. Like I said, this is a safe space. We are trying to help you out. Those questions that you find it difficult to ask your nurses, this is an opportunity for you to ask. And those questions that your doctors might not have the opportunity to answer because of their busy schedule and a whole lot of patients they have to attend to, this is an opportunity for you to ask. And if this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. Feel free to subscribe to our YouTube channel and also turn on that notification button so you don't miss out when we go live and also when we drop our new content. And if you've been watching this far, all I would advise you to do is to double tap the screen and like the video. Double tap the screen and like the video. So James said, I had PID and the doctor said I should go for HSG. I have been feeling pains in my lower tummy. I have been having bad discharge. Please, what should I do? Help me, man. I think if you had, did you tell the doctor that you were having PID? Because generally I think I'm not a specialist in that field, like I'll always tell you. I think what the doctor was supposed to do was to get the PID treated first. No, I think the doctor is in the best position because they are seeing you, they know what's best for you. But personally, I will say you get the PID treated before going for HSG. Like I earlier said, it can worsen things because the bacteria can actually go up and worsen the whole situation. So what I would advise you to do now, since you are feeling pains in your lower tummy and having bad discharge, I will advise you to go and see the doctor again. Go back and let the doctor know what you are passing through, just to make sure that the infection is not worsening, just to make sure that it is not it's not worse. Let's put it that way. Just to make sure nothing is going wrong. So that's what I would personally advise you to do. Go back to the doctor, complain that this is what I am facing after the HCG. So if it's an infection, they get it treated as soon as possible. Probably give you an antibiotics and some painkillers to relieve the pain. So I don't know if that helps, James. James, does that help? Feel free to ask your questions. And if you are watching, I believe you've gained a lot so far from the question. There's something I like about coming and ask and taking your questions. Like, it's a broad floor. We're able to take as much questions as we can. Okay, feel free to drop your questions. I like today's live section because it's not just about a particular topic, it's about you on this live. We've been able to take all your questions. That's one thing I like about today's live. There's a lot of questions. When there are a lot of questions, we are able to answer it, and I feel people are getting freer. They are free to talk about how they feel. All right. So we have Dada Tai who said, good evening, Nurse Mercy. How are you doing today? Thanks for the other day. Oh, what did we do? I know that Dada Taiwo, I know you are always on my life, but I don't know what I actually did. Your response were really helpful. Oh, that was great. I'm happy that my response were helpful. That's one thing I always say. I'm happy when I get this feedback. It simply means that we're doing something and people are benefiting from it. All right. Thank you, Dada, for the feedback. And I'm glad my response was helpful the other day. Feel free to keep asking your questions whenever we go live. And don't forget to support our channel by watching our videos whenever we pop the video. All right. Hopefully, I'll be dropping a video tomorrow from between 12 a.m. to 12 p.m. Let's just say I'll be dropping a video. Feel free to watch the videos and ask your questions in the comment sections. I'm planning to make a video on testicular pain because I'm getting a lot of questions too on that, causes of testicle pain in men. So I'm going to be making a video on that soon. So make sure you watch the video, anticipate the video. That's why it's very important for you to subscribe and also turn on the notification bell so you don't miss out whenever we upload. So we have Just One Day channel. Just One Day channel said, we are learning, keep educating us. Thank you very much. Just keep encouraging us to pop up by coming back watching and also asking your questions. No matter how crazy they may be, we're going to try as much as possible to answer them. So Illicit said, I've been using so many antibiotics, but it's not working for me. Illicit, one thing I would advise you to do, don't just get over-the-counter antibiotics and start taking. Because, see, I think this is very important. Please, if you are watching this video now, if you are watching this live, please don't leave. I'll keep saying it, but this is very important. If you are watching this live, don't leave. There's something I want to talk about now, because there's a question on the comment section and said, I have been using so many antibiotics, but it is not working for me. When you continuously take antibiotics over and over again, your body builds resistance to it. And it will not be able to work. Like the antibiotics will no longer work for an infection. So you might be needing a stronger antibiotics. Please, that's why I always advise, don't abuse antibiotics. I have always said it on this channel, don't abuse it. Yes, there are countries that it is available, it's easily accessible, you can buy it as far as you have money. But please, don't use your money to buy problem. Don't use your money to buy, don't use your money to buy things that will cause you harm. So my personal advice to you, Illicit, is for you to go to the doctor, tell the doctor the truth that you've used several antibiotics and you are not seeing any improvements. They might actually take a blood sample to see the antibiotics that your body is resistant to and the one that will work for you. If it's that bad, if it's like you've tried all the antibiotics and none has been working. So if you are not having some antibiotics resistance, which I'm not sure of, I'm just assuming, they might take a sample, do a blood analysis, then they find out the antibiotics you are resistant to and the type of antibiotics that is going to work for you. All right. So one thing I'm advising you before it gets bad, so it doesn't get worse, if you can, when it's morning, see the doctor. See the doctor and get that sorted out. Then this is a general advice I have to give. Whenever you're having an infection, you're having an itching, you're having like a smell, don't just rush to go and get antibiotics. There are some vaginal infection that don't need antibiotics, but they just need some cream, antifungal cream, or some pastries that you just insert because it's a fungal infection. For example, now somebody is having cottage cheese discharge, like the discharge from the vagina looks like cheese. The next thing you see this person doing is the person is going to get antibiotics. The next thing you see this person is that the person is going to get antibiotics. So please, cottage cheese discharge is not antibiotics. Stop doing this self-prescription. I know you are trying to save cost. You don't want to visit a doctor. You're trying to save cost because there is a high cost of visiting a doctor. But you just have to be careful. I'm begging you. You just have to be careful. Because when your body builds resistance to antibiotics, when you really need that antibiotics, it's not going to work again. Because your body is not used to it. Try as much as possible to avoid antibiotics as much as you can, except it is needed. I know what I'm saying, because there are a lot of people in the hospital today. There are a lot of people in the hospital today that are battling with antibiotics resistance. They have infection, but they can't find any antibiotics to actually treat that infection because they've abused antibiotics. They've used a lot of antibiotics, and their body is now like resistance to it. There's something called antibiotics resistance. If you don't know, you can search, go for it. You can read more about it. All right. As a lady, like I see ladies, like when they have sex, the next thing they want to do is to take Bicham Ampiclos. They just take it. They feel Bicham Ampiclos, just one tablet, is going to protect them from HIV, is going to protect them from gonorrhea, syphilis, fungal infection, everything. They feel it's going to flush the systems. I've heard people saying that they want to take Bicham because it's going to help them flush the system. It's going to make them healthy. You are doing that at your own risk in the long run. The more you do that, the more you put your health in danger. The more you take antibiotics without prescription, the more you take antibiotics without the need for it, the more you put your health in danger. So this is not me trying to put fear in anybody's mind. I'm not saying anybody has antibiotics resistance. What I'm trying to say, it's better for you to consult the doctor, let them run a test and know what it is. So that's my general advice. So I think I've talked more on that. So I'm just going to take the next question. Sorry, I have a lot of questions to hear. Okay. Just one said, what is one thing that makes a man not lasting long during intercourse? Okay. One thing that makes a man not to last long during intercourse: stress. There are different reasons why a man cannot last long during intercourse. And one of it is actually stress. As small as it is, stress can affect a man's sexual life. If you are stressed out, it alters your hormones too. It can affect your sexual life as a man, as little as stress. Okay, what are you taking in? I will always say on this channel, if you want to improve your sexual health, eat healthy. Alcohol, smoking is not going to help your sexual health. Alcohol, smoking is not going to help your sexual health. If you want to improve your sexual health, eat healthy. Same way they tell you, if you want a good heart, if you want your heart, your lungs to be good, eat healthy. That is the same way if you want to improve your sexual health, you have to eat healthy. Take food rich in zinc, omega-3 fatty acid. These are good for the sperm heads. These are good. These are going to help with erection things. All right, I've talked about this in my previous live sections, and I think I'm repeating it again. Eating healthy: bananas, nuts, walnuts, almond nuts, granuts. All these nuts are good for your health as a man. Bananas are good for your health as a man. Spinach are good for your health as a man. Sorry. Bless it, sorry. All these things are good for your health as a man. Water is good. All right, staying hydrated is very good, because when you're hydrated, it increases circulation. Smoking, alcohol, do away from it for your own benefit. So just one day said, I watched, I still have a lot of questions. So let's see. I watched a video online where a lady complained of involving in abortion, close to 35 abortion, and she's just 20. Please, do you advise our ladies to involve in that act? Abortion. No. Personally, this is a personal opinion, not a medical opinion. Personally, I am not a fan of abortion, and I don't advise abortion. You're talking about 35 abortions here. That's a lot. Even one is a lot for me. 2 is a lot. Personally, I don't in any way advise abortion. I don't in any way advise abortion, except for medical reasons. Except for medical reasons. I personally don't advise abortion except for medical reasons. You get, like, when you get pregnant, your body is already prepared. Your hormones are ready to welcome this baby. And all of a sudden, you take the baby out again. Your body is trying to regulate. Your body is trying to regulate and bounce back. You get pregnant again. You abort. Your body is trying. You are kind of stressing your body. I'm removing the religious factor. You are stressing your body. You are putting your body in much danger. If you know you can't do without sex, and you are going to continuously have abortions, then go for family planning. Go for family planning. Use condoms. There are lots of family planning out there. You have the pills, you have the implants, you have the intrauterine devices. Personally, I don't advise abortion. I don't in any way advise abortion. Nobody's going to come to me and tell me I want to abort and I will give you the go ahead. I'm going to tell you to keep the baby. That's a personal thing. I'm not saying it's a medical thing. You get? But if there's a medical reasons why the doctor said you should go out for abortion, that's fine. But for the ladies intentionally aborting the child over and over again to the extent of having 35 abortions in 20 years, as a 20-year-old, that's a lot for me. Because when did you start seeing your menses? Let's assume this lady starts seeing her menses at the age of, let's say, 14. That means within 7 years, within 6 years, you've had 35 abortions. So 35 divided by 6, that means you've disturbed your body several times in a year. You've altered your body's hormones several times. You've confused your body several times in a year. So just go for family planning and save yourself the stress. Save your body the stress. Because when you when you're taking as a woman, your body has started producing several hormones that are different from the ones they usually have. And you take the baby out, then your body say, okay, it's time to recover. Your body is trying to recover again. You're taking it again. And you're aborting. You're taking it again. Why not just go for family planning and save yourself the whole stress? That's what I advise. All right? That is what I advise. Dada Taiwo said, I'm here again. Please, the malaria bite has effect on babies because no matter how I spray my room with insecticides to stop the mosquito, somehow it finds a way to enter. So I want to know, malaria is very dangerous. Yeah. Malaria can be very detrimental. Malaria can cause a lot, can cause harm. It can cause a very, very serious harm. So what I would advise you to do, if you can get a baby net for your baby to always cover, like there's this particular bed they sell in Nigeria that has nets. You put the baby inside the net, then you zip it to protect the baby. Definitely when you zip it, like at least air is still penetrating into the net. So that's going to protect your baby. Because malaria is not something that's going to go totally away from Nigeria. Even in your home, no matter how you spray it, malaria is going to say mosquito is going to come around. So what I would advise is to get that net for your baby and always observe your child. If your child is having body temperature, if they are having any discomfort, always probably see the doctor for checkup. And if possible, they might, if there's malaria infection, they might give some anti-malaria medications. But most babies are usually strong, especially those that are breastfed. They're usually strong, but always protect them by using that net. All right. So Zachary said, is there any recommended tabs can I take to boost sperm health? What I would advise you to do when there are some, I don't have a particular tab that I can say you should take to help with your sperm health, but there are some brands out there, like I think Wellman, that make sure when getting this reproductive health supplements that they have zinc in it. Zinc is very important for sperm health. So I know zinc is very important for sperm health. So when getting those Wellman, I'm not prescribing. I'm just saying, okay, I've seen those products, Wellman, that talking about, okay, man trying to help them with sperm, the vitamins, it contains various vitamins. So you can get those ones and see how it goes. So we have Chidima in the house. Chidima, how are you doing? Trust you are doing great. One more thing, I have observed that, I hope all these people are here because the questions are long. So before I get to your questions, hopefully you are here. He said, one more thing, I have observed that we have become doctors on our own. Small headache is malaria. We go to the pharmacy and buy malaria drugs. I believe too much drugs have an effect on our kidney. You are very, very much right. Yeah, everybody's not a doctor because they are scared of this thing. Small headache, malaria. No, it's not just malaria. They'll tell you it's malaria and typhoid. Small headache, they will say it's malaria and typhoid. They will go and get malaria drugs. Then they will add is it amoxicillin? They will add amoxicillin to it and say they are treating for malaria and typhoid because they are doctors on their own. So please and please, too much of all these medications are not good. Too much of all these medications are not good for you. Sometimes those small headache, those fever that you see, your body just need rest. Sometimes it's not even malaria. Sometimes it's not the typhoid. Sometimes your body needs rest. Okay, so when you have those symptoms, don't feel it's malaria and just, I know malaria is very common. Malaria is very rampant in Nigeria, which we all know, because most times when we visit the doctors, they usually treat malaria for us. But for those adding typhoid to it, treating malaria and typhoid, oh dear good. President General, I salute you. Don't do that. Anyway, it's not good. Too much of all those drugs is not good. So it is said, the result was that I have fluid in the pouch of Douglas and it's very hard to get pregnant. That was why the doctor asked me to go for HSG when I have infection. All right. So, James, like I earlier said, go back to that same doctor and let the doctor know the signs and symptoms that you are having at the moment. So, probably he might be able to give you some useful advice. So, Matthew 7 said, I'll read this question, though it sounds crazy, but I'm going to read it. Can I have intercourse with my brother's wife? The answer is no. Why would you even think of something like that? And why would you be bold enough to drop something like that? I know this is a safe space, but things like that should not come to your mind. Things like that should not come to your mind. If you're having a thought of having an intercourse with your brother's wife, that's a bad thought. Kill it now as soon as possible. Try and kill it now. Kill it now before the end of this life. I want you to kill that thought right now. Kill that thought right now. I'm actually reading this question because I want you to kill that thought. The question is sounding crazy. It's sounding stupid to me. Sorry. But maybe I don't know why that thought is coming to you, but whatsoever that thought might be, I advise you to kill that thought now. Your brother's wife, like you said, is not your wife. You are not permitted to do that. I'm not permitting you in any way to do that. All right? Your brother's wife is your brother's wife. Just you have to kill that thought and it's bad. If nobody has told you that the thought of it is bad, then I'm telling you it's bad. And what I would advise you to do, since you are having that thought to have intercourse with your brother's wife, personally, this is my advice to you. Stay away. Don't, you see this mind, that's why you've had that thought to do it. Something might enter inside of you and you might rape your brother's wife if she doesn't come for it. If she says no, you might want to rape somebody. So what I would advise you to do personally is to stay away. Don't come close to your brother's house. This is I know people are like, why am I answering this question? But this is very important. I need to answer it. Yeah, it's very important. Don't go close to your brother's house where your brother's wife is. If your brother's wife is passing this way, go and pass another way. If your brother's wife is living in this street, park away from that street and go to another street. Because as far you've conceived that thought, it's just 1 second you will do it. So the best thing is to avoid the areas of temptations by not coming close to your brother's wife. This is a very important question. That's why I'm answering it. Don't come close to your brother's wife. Stay away from them. That's what I'm telling you right now. So if you and your brother's wife is living in the same house, the best thing for you to do is to run away from that house as soon as possible. So that's my advice for you. And I hope that helps. And I wish you all the very best in self-control. Try and put her in the next bed. So that's what I would advise. Just one day, China said, please, is there any home remedy to cure runny stomach apart from ORS? If the runny stomach is consistent, I would advise you go and see the doctor. Like bananas. Bananas help too. Bananas help with the runny stomach. But if after using ORS, you've used the home supplement and you are still having runny stomach, I would advise you see the doctor. And sometimes this runny stomach actually from the result of the food we eat. So find out what you are eating that is causing you to have the runny stomach, for your stomach to be running. That's how we call it. We understand what we like as Nigerians. I believe you understand when we say runny stomach. So first of all, look for what is causing that upset of your stomach and try to sort it out. It might be a particular food you are eating. It might be a particular diet that you are having. That's why you are constantly having that runny stomach. So what I would advise you to do, if there's a particular food that aggravates it, stay away from that food and also see the doctor if it is consistent. Because if you're having frequent runny stomach, it can lead to dehydration. You'll be dehydrated. And dehydration can lead to death. Yes, you heard me right. It can lead to electrolyte imbalance and it can lead to a lot of things. So it's better for you not to be dehydrated. It can even lead to low blood pressure. And when there's low blood pressure, you know what that means, not good. So what I would advise you to do, if that running stomach is consistent, if that running stomach is making you dehydrated, try using ORS and also see the doctor to find out what is actually causing it. So Area Vanga said, I fat and she's done. Oh, sorry about that. Susan Ogochuchu said, my menstrual flow reduced from 3 days to 2. I hope it's still normal. The normal, like I always say on my channel, the menstrual cycle, the menstrual days is usually between 2 to 7. So anything between 2 to 7 is normal. So if it reduced from 3 to 2 and you are not having any funny symptoms like pains, like you're not having any funny symptoms attached to the reduced period, then for me, it's not something to be concerned. Your normal period should last from 2 to 7 days. 2 to 7 days is fine. So Eze says, what about my friend's girlfriend? No, don't do that. It's a friend's girlfriend. Have some self-respect, Eze. It's a friend's girlfriend. So if you've considered thoughts, I think this is very common. It's not just with girlfriends and boyfriend. Like, it's very, very common. I think I have to talk about it. It's not something I should keep under the carpet. You can see someone said, can I sleep with my brother's wife? And another is asking, can I sleep with my friend's girlfriend? You can see the whole thing. Let me tell you something. As a man, there's nothing like having self-control. That's one. And also, if you have that thought of having something to do with your friend's girlfriend, what I would advise you to do is to stay away from them. If you have the girl's contact on your phone, block the girl or delete the number mistakenly and say, oh, you don't know what happened. The number got lost from your phone. Take that number away from your phone. That's the first step. Whenever the girl is around, don't go there because you might be tempted to do something you don't like, or you might regret, or you are going to betray your friend. So the best thing is to avoid those people that are tempting you to have something to do with them when you know they're already involved with someone else. So that's my advice. Oh, we have a lot of questions. Oh, where do I start? Okay, I'm still going. So just one day channel said, the reason I asked this question, I know someone who resorts to mixing sugar, salt, and water. Is it preferable? What question was that again? That's sugar, salt, and water is ORS. It's same thing as ORS. Sugar, salt, and water is ORS. Just that that person is doing their own homemade ORS. So sugar, salt, and water is ORS, oral rehydration solution. So they are doing their home base. Just that with home base, you might not get the accurate amount. But with the ORS, they already tell you use this particular liter of water, put this one inside. But when you're trying to make your own, you can make your own. I think a lot of people make theirs. You can watch some YouTube videos from doctors or nurses that have the idea on how to make ORS. I can't remember how to make ORS because I can't remember when last I had something with ORS. But sugar, salt, and water is actually ORS. This oral rehydration solution. So it's homemade. It's like different from the one you buy. The one you buy is that thing you buy in the sachet that they said is ORS. It's actually salt and water, salt and sugar put together. So Aria Vanga says Susan is getting pregnant slowly. That's good. Congratulations. As I said, how about drinking alcohol every day? Every day is not good now. Alcohol is not good for your body. Alcohol is not good for your body. If you can limit it and stop it if you want. Ayomide said, please, is there anatomy and physiology lectures? If you want to have access to our physiology and anatomy lectures, there is a Telegram group that's for nursing students only. It's not for everybody, it's just for nursing students. You can send a message and I'll tell you how to go about it. So Eze said, like hot chest. I don't advise you doing that. I don't advise it. I don't advise it. It's not good. When you take that, you are actually affecting the organs in the body. Your organs in your body are not happy whenever you do that. It gives you confidence. What kind of confidence does it give you? You should have a confidence. You don't need alcohol to be confident. I think I've heard that severally. People say, alcohol makes me bold. Alcohol makes me say things that are on a normal, when I'm in my normal senses, I will not be able to say. But when I take alcohol, I'm able to say things. I'm bold. I'm confident. I can do anything I want to do. But I think you should try to work on your confidence without alcohol. Because when you are taking alcohol and you feel you are that confident, you are bold, I'll say it's not boldness. It's not actually confidence. It's just alcohol doing its thing. So you should work on your confidence level. You should work on your boldness level. Aminita, a lecture on arthritis won't be bad. A lecture on arthritis. I think we might talk on arthritis tomorrow. Let's see how it goes. I'll try and see if I can talk on arthritis tomorrow on my live session. Just be here. Then Cabro said, please, nurse, I want to know what means I should apply to protect my infant baby when I've having sex with my husband. When you say your infant baby, does it mean you've already given birth to the baby? What are you protecting the baby from? That's one. Are you talking about the baby in your womb, or like you're pregnant? Are you pregnant? Is that what you're trying to say? Aminata, please clarify your question. Protect your infant baby doesn't mean you've given birth to the baby. If you've given birth to the baby, you can have sex with your partner. So I don't really understand what you're trying to say, Aminata. Ayomide said, yes, I'm a nursing student. Okay, I'll send a message on Instagram, Ayomide. The class is 7,500 naira. When you pay, you have access to the class. Just anatomy, physiology, and medical surgical nursing. It's voice note. The voice note was prepared long ago, but it's very simplified for all nursing students. So after payment, you have access to the classes. You can send a message on Instagram and I'll tell you how to go about it. I'm going to Standard College of Nursing, Mina. So I need a good online lecture. So like I said, send a message on Instagram. Well, we've actually spent a lot today. We spent a lot of time today. Do we still have any questions today? Arya Vanga said, my mom has psoriasis, skin allergy, like red patches on her arms, and she has fungus type of allergy in her nails. I'm so much worrying about her, and she has that for 25 years. So in terms of psoriasis, I am not in a better condition to give advice in regards to skin conditions. So I would advise she speak with a dermatologist. Hopefully a dermatologist is able to provide useful help. So dermatologists are doctors that actually deal with the skin. All right. Yeah, she should. Normally, staying hydrated is good. Staying hydrated is good, but I am not like I'm not a dermatologist to give specific advice for that. But generally, water is good. If you have the finance, you can take her to see a dermatologist. Let them just check it and see what they can do about it. Chizoba, how are you doing? Trust you are doing great. Welcome to Nurses Lecture Room Live. For those that are just coming across this channel for the first time, like Chizoba, my name is Mercy. I'm a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse, and I am a member of the UK YouTube Health. So on this channel, we talk about sex, we talk about reproductive health, and we talk about your health in general. And those questions that you are shy to ask, this is an opportunity for you to ask it. Those questions that your doctors are not having enough time to explain, this is an opportunity for you to ask them. We are not giving you personalized advice, we're just explaining things in a general term. Because for all your generalized or personal advice, you have to see the doctor. And if this is your first time of coming across this channel, all you have to do is to subscribe to our YouTube channel, click on the subscribe button, and also turn on that notification bell so you don't miss out when we go live and also when we upload our new videos. So turn on the notification button so you don't miss out. Then also, if you've been watching this live for long, I believe you've learned a lot today. We've answered several questions today. I believe you've learned a lot. Why not double tap the screen and like the video? Double tap the screen and like the video. Double tap the screen and like the video. It's been an interesting section. I think, okay, just one day channel said, ladies and gentlemen, we need to upload Nurse Mercy Mary. I think I have an upload here. I think I need to upload myself. Let's see if it's working. I'm supposed to have an upload here. Somebody said they need to upload Nurse Mercy Mary. It's been wonderful. Okay, I've uploaded myself. Let me upload it again. You can hear that. You can hear that. Yeah, I've uploaded myself. They said, okay, ladies and gentlemen, we need to upload Miss Mary for such an interactive and educative lecture. We pray for good health for you and long life to live long and keep on educating us. We love you. I love you too. Thank you very much for this beautiful comment. Let me screenshot it. That's good. All right. Thank you very much for those beautiful comments. I really appreciate just one day channel. It's nice actually being able to answer your questions. And I'm happy that the questions that have been asked, They are actually questions I have ideas on. All right. So Eze said, still on the alcohol, what are you saying about the alcohol, Eze? What are you saying about the alcohol? Area Vanguard said, oh, okay, I understand, sister. But here in Pakistan, doctors are like businessmen. Business here, they just want money. They don't reduce the allergy, but they always give her medicine, which maintains the allergy. So, see, generally, when someone is allergic to something, it doesn't just like, it doesn't go away. For example, there are cases where people are allergic to nuts. There are some people that take cashew nuts and they're allergic to it. There's some people that are allergic to dusty environment. So allergies don't just go away. They can be managed. So most allergies can be managed. All right, they don't just go away. Okay, Eze, let's talk about the damages of alcohol to the body tomorrow. That's because it's going to be in details. Let me type it down. I'm just going to type it down. I think we should talk about that tomorrow because if I want to explain that, I'm going to spend more time on this live. So can we talk about it tomorrow if that's okay by you? I'm just going to type it so I don't forget. I'm going to work on that. We're going to talk about it in details tomorrow if that's okay, Eze. So if you are joining us, stay around. Tomorrow we are going to be live and we're going to talk about the dangers of alcohol. So on tomorrow's live, I'm going to be talking about how the alcohol affects the brain, the heart, the various systems. I'm going to be analyzing it. That's a big topic on its own. Okay. So Chisaba said, please, Nurse Mercy, I get so confused on how to know ovulation day and most fertile day. Then this is 10 months. Okay. Someone asked, I was about calculating the ovulation day for someone, but my board is not here. It's actually there. It's actually far away from me. So please, tomorrow during my live session, I'm going to bring the board closer. I would advise you to join our live tomorrow. Then I'm going to help you out with it. Okay. If that is okay, Chizoba, join our live tomorrow. I'm going to bring the board. Then we are going to do it together. And also, while coming for the live, make sure you have a calendar with you so that I'm able to explain better. I'm going to have my personal calendar. I'm going to have my board, and I'm going to help you calculate your life tomorrow. Your ovulation, not your life, sorry. I'm going to help you calculate your ovulation tomorrow because I have some questions in regards to that ovulation calculator, and I moved them to tomorrow's live too. So Linda Ochechi said, this is 10 months since I gave birth to my second baby. I have not started seeing my period. I'm worried because it did not take long on my first baby. Your bodies are different. Everybody's different. If your child is still breastfeeding, even if it's not exclusive, your child is still breastfeeding, that could be the reason why your period is not back yet. All right. So breastfeeding might delay your period. So immediately your child stops breastfeeding totally, the period might come back. So I don't know if you are still breastfeeding, Uchechi. That could be the reason why. As I said, just brief. It's a lot to talk about. It's broad. Generally, if you say brief, I would like to tell you that alcohol is not good for your body because it affects your various organs. It affects your lungs, it affects your heart, it affects your kidney, it affects every part of your body. So that's why I said I'm going to be explaining it in details tomorrow. Okay, I think I need to go. I've spent more than 1 hour. I'm not supposed to spend more than 1 hour. The life was supposed to last for 1 hour, but the questions are getting too much. I don't think I can keep up. Okay, I think just one is just Sana said, I suggest we end today's lecture for today so we can rest and come more with our questions. Yeah, but let me see if I can let's pray. Father, we thank you for successful lecture. Help us that the educative lecture will sink in our hearts and let your will be done in Jesus' name. Amen. Amen. So Ara Vanguard said, I have never studied, but once I told her that your skin is not the main issue, but you have receptors kind of things in your blood for allergy, I told her to get the medicine which reduced those receptors, and her allergy was almost gone, like 30%. That's good. That is good. Like I earlier said, when it comes to skin, I give it all for the dermatologist. I have no idea about skincare. I have no idea about acne and all that because I am not a dermatologist. I am not a skin expert. So I can't really give useful advice. But if you did something that worked for her, that is really, really good. So Chizoba said, what time, please? It's going to be between 9 to 10 p.m. Like you all know, I am a nursing mother. I have a 6 months old. So I'm still sleep training him, but he before 10, he's on bed. So he's the one that determines my life when I'm coming. So before 10, he definitely sleeps before 10. So I'm sure he sleeps before 10. So I'm not going to have issues. So it's going to be between 9 and 10. I'm going to be in live. It could be 9 o'clock. It could be 9:30. It could be 9:45. It could be 10 p.m. It could be 10:05. But I will be there tomorrow. Because most times, I'm always live except the days my husband is off. Because when my husband is off, most times it's more or less like a family time. So I don't do live most times when my husband is off duty. I don't go live. Yes. When my husband is off duty, it's more or less like a family time. So I do less work during that period. So it's when he's on duty, I am still on duty. So everybody's working. But when he's home, we have family time, private times, kids and everybody. So no life most times when my husband is, except like except something comes up though. So I'm always live. Yes, my lungs always look sometimes. I'm going to explain. All right. I'm going to explain, like Ella said. You come up to the live tomorrow, Easy. Come up to the live tomorrow, Easy. Let's talk. Come up to the live tomorrow, Easy. Then we'll talk better. We'll talk about that alcohol danger. Yes, nerve function tests exist. It's possible they exist. Nerve function tests, they exist. Yep, they do. Gamma said nerve function test. The questions are getting plenty. Oh my god, sorry. The questions are getting plenty. So nerve function test exists. I've told you about the time tomorrow. Okay, Linda Ochechi said, yes, I'm still breastfeeding. That is the reason why you've not seen your period. But immediately you stop breastfeeding, you are going to see your period, okay? That's good, Area Vanguard. That's good. That's good. That's good. All right. I think we've tried for tonight. We've spent more than an hour talking. We've spent more than 1 hour asking a lot of questions. So what I would advise you to do tomorrow, just turn on that notification bell, subscribe. Like I earlier said, I come online between 9 to 10. It could be 9, 9:15, 9:30, 9:45, or 10 p.m. or late as 10:05. But within that time, I usually come online because at least I'm sure my kids are sleeping. Okay, it's just my 6 months old. I'm still trying to sleep train, but my soon to be 3 years old daughter doesn't have issues. But my 6 months old, I'm still trying to sleep train him, which actually we're still seeing. So tomorrow we are going to be live. All you have to do is to come live. Simple. And if you are that person that wants to calculate your cycle tomorrow, come with a small calendar. It's going to be the one on your phone, but make sure you are here with a calendar because I want you to do it yourself. I want you to understand it yourself. So it's going to be interactive. If you don't understand it tomorrow, let me know. I will explain it as much as I can over and over again. All right? Come with your personal calendar tomorrow. Come with your personal calendar tomorrow. We're going to be doing it and I'm going to explain. I know sometimes it can be a bit confusing. Yes, it can be a bit confusing. You're not like, okay, after calculating my cycle, when is my next ovulation? You now start calculating it. So come with your calendar tomorrow. If you want to calculate your cycle, we're going to be doing it together for you, for all those that want. Just make sure you're online. That's just it. Then tomorrow we are still going to talk about alcohol. Just make sure you join the live tomorrow. We're going to be talking about alcohol, the damages alcohol can do to your body. And I think that is that for tonight. We've tried for tonight. Kudos to Nurses Lecture Room. And the last speech for tonight is, if you are just joining us for the first time, my name is Mercy Mary. I'm a registered nurse and also a registered midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse, not as a midwife. But why am I using but? Okay, anyway, but I work in a theater. I work in a theater as an anesthetics and recovery nurse. Yeah, we take care of the patient before they sleep. You understand? We take care of the patient before they sleep, they have their surgery. We take care of them while they are back with their surgery, their recovery. So that's what I'm currently working. But at the moment, I have all the time because I'm on maternity leave. Yeah, I'm on 1 year maternity leave. I'm going to be resuming work October, which is quite fast. So I have all the time to do all the live and take your questions. If this is the first time, kindly subscribe to our YouTube channel. Subscribe to our YouTube channel. Like, click on that subscribe button and subscribe to our YouTube channel. And don't forget to turn on the notification bell. If you're watching this live and you've not double tapped the screen to like the video, I really don't know why. Because today was really educating. Today was really informative. I enjoyed myself here today, and I believe you all did enjoy it yourself. Thank you very much, and see you in our next live tomorrow. Thank you very much. See you in our next live tomorrow. Bye, everyone.